Requiring a result from an X-ray or pathology test is a common aspect of clinical care. During a patient consultation, such as a ward round or in an emergency, a clinician will review recent observations or changes in the patient and often consult a laboratory or radiology system. This informs them of the patient's care and enables them to make a more informed decision about further treatment. Some community and mental health hospitals still use paper to communicate with their local pathology and radiology services. This can lead to test results being missed and patient information not being kept up to date. There is also a risk of clerical errors, with results being applied to the wrong patient record. With paper-based processes, information can easily be misplaced. Specimens can be delayed or lost, and clinicians are often unaware when results are ready. Common issues arising with paper-based forms include unclear handwriting, insufficient space for all information for special or uncommon tests, incomplete sections. The paper order can be easily damaged. Plus, there can be multiple forms to choose from depending on speciality. Tests can often be requested more than once, as other clinicians don't always have the information to hand that a request has already been made, leading to duplicate requests being made to the laboratory or radiology department. Inappropriate or high-cost tests can be requested by staff without an authorization process, which then means laboratory or radiology staff may have to waste valuable time chasing authorization requests. Similar problems arise when collecting and transporting bloods and samples. A phlebotomist will look at the tests, then select suitable sample containers, label them and put them in a plastic bag with the order form. These tubes can be difficult to label manually, and information can easily be mismarked or even missed altogether. It's vital that the details on the tube and the order form match up precisely with a patient on the lab system. With paper ordering, it often doesn't, leading to the patient being registered again on the lab system. This error is usually rectified later, but time and resources are wasted clarifying the issue. When a sample has been tested, the results are entered onto the lab system. If there is no order comms or results reporting, the result just stays on the system because there are often no trigger reports. This means that the person who ordered the test must keep manually checking their system until the result is available. In one trust, staff checking the order system 2 to 3 times a day for the result of orders that have been taken has cost £320,000 per annum. This can be saved by having trigger reports. As the result is paper-based, this paper is returned to the ward for a clinician to review and then incorporated into the paper records. In busy departments, this can lead to difficulties tracking a manual paper trail. How does RIO order communications and result reporting help trusts? With RIO order communications and results reporting, an electronic patient record shows everything that has been raised for a patient in the past across pathology and radiology. As well as seeing requests, clinicians can also see results and any abnormalities. The benefits to a trust are significant. Users do not have to view different systems. The results are shown alongside other EPR functions. On receipt of a result, the system automatically triggers a notification for the clinician in the system, which can be automatically sent via email or SMS. The ordering process is optimized and can be configured with frequently used tests and order sets. The system remembers the recent orders. Pop-up notifications direct the user to more information about the test or order set. This helps learning and development and familiarity about the test or local trust policies. Order duplication is reduced, preventing the patient from being tested twice for the same condition. RIO order communications and results is aligned with the Carter Review, which highlights efficiencies to be made in the NHS, specifically around more effective use of pathology services to improve patient outcomes. Trusts can save on costs and increase efficiencies by eliminating manual processes, enhance patient care and safety, and achieve paper-light ambitions. Reduce duplication of requests to laboratory and radiology services, reduce inappropriate ordering of incorrect or expensive tests, stop requests from being sent to laboratory and radiology services without the correct level of authorization. This RIO Order Communications module can result in NHS trusts achieving a 30% reduction in time spent ordering, a significant reduction on chasing results, substantial cost savings through digital efficiencies, an increase in staff morale, efficiency and a better understanding of a patient's history. Get in touch with our team and move towards a future that provides better digital care for patients and meets the targets of the NHS long-term plan.